If you're sipping through a straw, thinking that it's healthier, it won't stain your teeth, think again. You might be aging your lips faster. Those vertical lines around the mouth, what people call smoker's lines, do not come from smoking alone. They come from muscle movement, bone loss, and daily habits that you think are harmless. And here's the good news. Most lip lines are treatable and many are actually preventable if you use the right strategy. The caveat is, guys, if you want best results, you have to act on them before they become very deep. So time is really critical there. I'm Dr. Morgana Colombo, board certified dermatologist, and today I am breaking down what is the dermatologist protocol for erasing lip lines, what actually works at home, how lasers like CO₂ or UltraClear can help, and why Ellacor has become a game changer when it comes to upper lip aging. If lip lines are bothering you, stay with me because this would save you years of frustration and money. Before we fix lip lines, we need to understand why they form, because treating the wrong cause will lead to disappointing results. So one, the muscle problem. The muscle around your mouth, the orbicularis oris, is a circular sphincter. Every reminder, pursing, straw sipping, whistling, all movements, all those things create repetitive folding of the skin. And over time, just like folding paper again and again, the crease becomes permanent. Two, there's collagen, fat, and bone loss around your mouth. So after 40, we lose collagen in the skin, fat pads around the mouth, and even the bone support in the jaw area. So without that scaffolding, the skin collapses into vertical lines. And let's talk about the straw myth. Yes, it is real. Straw face is not a TikTok myth. If you use straws daily, you are training wrinkles into your lips. So don't do it. So let's talk about how to fix this. At-home fixes. So let's be clear. At-home care prevents and improves early lines. It will not erase deep etched wrinkles alone. And here is your dermatologist approved starter kit. One, retinoids. So retinols, over the counter or prescription, they can promote collagen in a tiny little bit around the lips, not on the lip itself, can really help promote collagen, exfoliate, and help the area. So you have to use it for basically 3 to 6 months to really see any kind of result. Sunscreen is really critical because, sun damage leads to, loss of collagen. So sun damage, burned collagen. So make sure you do that. And then the other ingredient at home that can help are peptides and of course hydrating ingredients. So peptides like palmitoyl tripeptide 1, they're not going to paralyze muscles, but they are going to improve skin resilience and hydration, which softens, fine lines. So think of peptides and as supportive care, not miracles. Now, when do you come to the office to get your lip lines treated? So if you can see lip lines when your face is relaxed, creams alone are not going to fix them. So that's where a professional treatment may be needed for some transformation of those lines. One, Botox. So the lip flip situation. So tiny little doses of Botox around the mouth are going to relax the muscle, the orbicularis oris, and reduce pursing force and prevent future lines. Micro-filler is used to fill those lines very superficially. A thin hyaluronic acid, just a small amount, is going to create this smoothing effect on the lines. The best option though for like etched lip lines are resurfacing lasers such as CO₂ or UltraClear. So if you have those deep lines, it's the way. But there is downtime with that, which is usually around 7 days. The laser will burn off the top layers of skin and then also induce some internal heat, which promotes collagen and improves those lines. But it really takes time to see the full improvement, 3 months usually. And then the last thing I'll mention that can be done in the office is Ellacor. So if your issue is excess or sagging upper lip skin, listen closely. Ellacor is maybe the way for you. So it removes little tiny cores of skin with no heat damage, and it tightens the upper lip vertically, acts like a mini non-surgical lip flip. So for the right patient, this is a great treatment. With Ellacor, again, it's a great treatment, but it's not a miracle treatment. You may have to repeat it 2 or 3 times to achieve, good results when it comes to your lip area. So again, the best lip line results rarely come from one treatment. They come from a combination. First, you can use some Botox to relax the muscle. Second, you can use some filler to just kind of give some support around the mouth. And then lastly, you can use a resurfacing laser such as CO₂ or UltraClear to resurface the lines. And we have the fourth option of Ellacor, if you have a lot of extra skin there, to almost give you like a surgical lip flip kind of result and also smooth out the lines. Also, of course, skincare at home is critical. So you want to be on your retinol, good hydration, peptides. And lastly, drop those straws. Do not use straws. That constant motion is just going to continuously aggravate your lip lines, and they're never going to go away if you keep using them.